So I'm actually following more of the Martini layout. So again, if you're using OpenStax, you have to kind of like, I have the slides up already, but again, this is why it might seem if you're using OpenStax that I'm bouncing around, but I think the Martini organization of the nervous system slightly makes a little more sense. They both have their strengths and weaknesses. Okay, so here are just basic types of neuronal poles. As we see here, all these different types of neurons are in different types of arrangements and sending signals in different ways. Like here we have one neuron sending signals to multiple other neurons, whereas here we have multiple neurons sending signals to one neuron. And nerve plexuses. So what is a plexus? Well, first we'll talk about this other term. So this is a very important term you'll hear a lot this semester, or actually for the rest of this semester. And you did probably saw this term when we covered the muscular system. So what we have is innervation. So basically, it's just talking about how are nerves distributed to the body and where it's distributed. So if you say a nerve innervates this area, that means that nerve is connected to that area, and that area gets signals from or sends signals to that nerve, and also gets signals from that nerve. So innervation just remember just refers to what areas of the body are supplied by a nerve. Again, the supply, except for the C1, is mostly two ways. So it both has sensory, it both gets or sends signals to the central nervous system, but also receives signals and carries out effects. So nerve plexus, compared to those previous neuronal poles we saw, so plexus is a highly branched network of these nerves. So there are, in terms of like the somatic nervous system and the ones that control your muscles and the regions of your areas of surfaces of your body. So there are actually depending on who you go up, but these are the main ones I want you to know. Cervical, brachial. So again, cervix referring to the neck, brachial referring to the arm, lumbar. So that's the lower back, right? And then you have your sacral, and there is a coccygeal plexus as well. And actually, rewind a bit. So sometimes you might see in other textbooks that the lumbar and sacral plexus are collectively or together known as the lumbosacral plexus. So just knowing that sometimes these two are lumped together, and I'll show you why they're kind of lumped together really soon. In the coccygeal, there is a coccygeal plexus, but for this class, you don't really need to worry too much about it. It does exist. That's why I'm putting it there for completion's sake. Okay, so this is the OpenStax version, and look at this. As you can tell, all these roots here, and they form these networks, but look at these networks. It's kind of hard to tell, and I'm like, am I going to use, okay, so am I going to use this image and test you on it? Am I going to point to this mass right here and ask you what nerve is that? Thankfully, I think that's unfair. And again, but in terms of your peripheral nervous system, I think this is the only picture in OpenStax. So this is what you have to work out with. That's why I'm giving you the Martini versions as well. They're still complex, but I think it's really hard to study off from this. So don't worry about me testing you from this image because again, as you can see it here, especially and again, this is why sometimes people group the lumbar and sacral plexus together. So this is why they call it the lumbosacral plexus. Notice that it's all interconnected right here. So notice that it's kind of like entangled with each other. Okay, so this is cervical plexus. This is the Martini version. And okay, so you might be like, oh my God, this is really complex. And it is. And the way you have all these loops, you have all these networks. And again, a plexus is a network of nerves. What do I want you to concentrate for this class? Now, in more advanced classes, and especially if you go into physical therapy, PT, or anything involving medicine, you will have to know spinal segments. But for this class, I think that's a lot of, because the thing is that you're memorizing pretty much, this is almost like pure memorization, and there's already a lot on this upcoming exam and for the rest of the semester. So spinal segments, not really for this class, but in the Martini slides I uploaded here on Top Hat and La Lima, so where it has these bolded ones, I want you to know which plexus this is a part of. And hey, this is where all those root words come and the knowledge you built up from exam 1 and 2 come in real handy. So like auricular refers to ear, right? Occipital, hey, like the bone, right? Cervical, neck. Ansa cervicalis, I mean, that has cervix, that has neck in it. Supraclaviculars, again, supra meaning above. It's like another derivation of superior. So above the clavicles, you have the supraclaviculars. And phrenic. So this is what you should really pay attention to. So where is your diaphragm? Is it in your neck? No, right? It's all the way below your lungs, right? Between your lungs and the liver. It's in your abdomen. So the phrenic is kind of an exception. Notice that this one innervates and controls the diaphragm. So the nerve that supplies your diaphragm runs all the way from your neck through your thorax and down into your diaphragm. So this is a kind of something. So this is why I really want you to pay attention to the ones that you can't just figure out just based on the names, especially things like the phrenic. And then the brachial plexus. Ooh, look at that. All of these types. But look at the names of this, like scapular, again, your shoulder blade. Subclavius, again, below the clavicle. Suprascapular, scapula, your shoulder blades. Your pectoral, subscapular, thoracodorsal, axillary, your armpit. And then musculocutaneous. Yeah, so some of these they don't tell you exactly that, okay, it's part of the arm. But things like ulnar and radial, well, that's part of your forearm, right? So a lot of these nerve names, you can kind of guess which plexus they're a part of just based on their names. It's the ones that don't have obvious clues like median or musculocutaneous, you have to kind of just know. Now, am I going to point to a part and ask you, okay, which is this nerve? I think that's a more advanced level question, but I'm going to teach you something that might be very useful, especially if you're going to medicine or physical therapy.